Hi, and welcome to the channel. How are you doing? All right, so I see that I'm all good on Facebook. I'm just waiting for YouTube to start. Wonderful. All right, says I'm rolling and I am ready to go. All right, so let me change the view so that you just see me. Hi, everyone. It is Dr. JB, and this is part of my series, Mentally Speaking with Dr. JB. Last week was the first of the series. I'm sorry, I'm clicking around. But last week was the first of the series, and in that, I introduced myself. I also gave a little bit of information about myself. So if you want to see the intro, see a little bit more about me, I'm gonna move this over. It's a little bit more about me, what I'm about, my philosophies, all that, my training. That's in the other video. And in the first video, I'd also like you to see it because I have a spin on resolutions, New Year resolutions, which are feeling goals for the year. So if you want to see more about that, go check that out. That's the first video. And this video is going to be the first video where we start doing the actual lecture. So let us start that. I'm going to look again to see how things are going. It's delayed on this end, so I'm just going to go with what I see here. All right. So let's get started. So you're going to see me small for some of this. Aside from if I maybe see a comment or something, I'll be small, but most of it will be these lectures. So the way I'm thinking about doing this channel is I'll be doing like a lecture series, something about mental health. Instead of doing it on Udemy or something else, I'll do it live. And if you all have any questions or something, I can kind of answer it in real time. So that's my goal. That's what I'm thinking about doing for this channel. And then the directions might change. I even said in the first video that I might think about having guests on, even having people share their personal experiences. Very free, very, not always serious. And then I do on this channel, the Jill of All Trades channel. If you follow, even on Facebook, it's not only mental health content. So sometimes I'll do lives and it won't be as structured as this. It'll be mostly like what I did to prepare for this or how was that or fun things. But I will be doing these lecture series. I think this is the best way for me, how I like how I've conceptualized that I want to like spread mental health awareness, but also be accessible and down to earth about it. This is my first time doing Restream IO, so if anything's kind of wonky, I'm going to blame it on that. But let me go back to the site to see if there's any comments. And that's something I'll do periodically is see if there's any comments. And then from there, answer any questions you all might have. All right. So all things mental health. Basically, it is a psychiatrist taught course on when and how to get help for yourself and loved ones. So I first started this course, I think I made this course about 2 years ago, and its conception started even probably maybe 3 or 4 years before that. I did a kind of a Bible study at my church. It's really cool. And maybe one day I could do that on this channel as well, where me and my pastor, Benjamin Miller, we wanted to do something for the congregation where I spoke about mental health treatment, and then he spoke a little bit about how to conceptualize different aspects of mental health as a Christian. And I did some research on that, even did a paper on that. If you look me up, you'll see like some literature in journals about that. And afterwards, I said, well, I had a that was fun. It was great. I wanted to do something kind of like that was more accessible to even more people. So I made a Udemy class. This is essentially, well, this is the Udemy class. And the Udemy class is, for the most part, exactly the same class that I gave to the congregation of my church. The only difference is that part where my pastor spoke is not there. Fabulous. So I'm trying to flick the screen. I'm just gonna click it. So disclaimer, the information presented in this course, like throughout the weeks, any weeks that I do mentally speaking with Dr. JB, any of the lectures I do are intended for informational purposes only. So that means, although I am a doctor and some of my patients might be on here, I even might be your doctor, the information in this course or any of the courses that I do are not intended to be used for medical advice or treatment. The information in this course is not a substitute for professional medical advice. Even though I am a clinician, I am giving medical advice. This is not a substitution. So it's not a substitution for professional medical advice, diagnosis, and treatment. And you should never ignore or avoid, please don't avoid seeking professional advice because of something you heard or learned from these courses. The purpose of this course is actually to encourage people who need to get medical or psychiatric treatment to get it, not to hinder that. So that would be completely against the goal, but I just need to say that anyway. Don't let this be a deterrent. And then also the opinions and information presented in this course are not representative of my places of employment or my professional affiliations. So we got that out the way. All right, so why do we need this series? So the first thing is 1 in 5 adults in the United States will experience some form of mental illness. So you have a hand, the thumb at least, 1 in 5, basically, 20% are going to experience some type of mental illness sometime in their life. The other thing is 90% of those who die by suicide had an underlying mental illness. And suicide is the 10th leading cause. Well, this is as of, I think, like 20. This might have been like very, like really before the pandemic or like right after. So these numbers might not be exact, but I'm pretty sure they're either comparable or even more jarring, where 90 where suicide is the 10th leading cause of death in the United States for adults, and the leading cause of death of adolescents from 14 to 15. Moreover, mental illness causes a significant burden of disease, and depression is the leading cause of disability worldwide. So I had to talk about like burden of disease. Another thing that I try not to do, but it's hard as a clinician not to do, or doctor, whatever, even that can be jargon, is that we use a lot of jargon. It's hard not to use terms that we feel is like commonplace because we use it so often. So if you are in the chat and you're like, what's that? That'll be helpful. So what I'll do is I'll probably look at the chat after I finish, a whole slide and see if anyone said anything. But essentially, I will also try to clarify things along the way. So burden of disease, for example, is a sum of the mortality and morbidity for a given disease. So it considers the health, social, political, environmental, and economic factors and they put all that together and determine the cost of that disease and the disability that's exerted upon the person or society. So it meant essentially it's saying like, how much is this disease costing us and you? And it is one of the mental illness is a significant cause of burden of disease, and depression is the leading cause of disability. So it's a big deal. And then nearly 60% of adults with a mental illness didn't receive mental health services in the previous year. So that's the main reason actually why I'm doing this, because I found out, I mean, I could just assume, but even from the lecture series that I did in the church, and whenever I do any type of lecture series or any information with people that are not in the field, they, even though they hear words, you may see things on social media, um, that doesn't always equate to they're talking about me and I need to get treatment, or they're talking about a loved one and maybe I should be a little bit more serious about talking to them about getting treatment. So let me see if there's anything on the chat. As of right now, it's not showing me anything, so I'm gonna take that as a set as a signal to keep going. All right, so there'll be three three main things that I do um, for each illness that we talk about. So essentially, we're gonna cover each of these illnesses. So depression, anxiety, bipolar disorder, psychotic disorders, ADHD, eating disorders, substance use disorders, and personality disorders. Over the course of the next few weeks, we are gonna go through all of those. And I kind of have a systematic way of doing it. So first, we will recognize. Recognize is just saying the basic symptoms. Essentially, when I made this course, I went through the DSM-5. That has been updated quite a bit, but still, for the most part, the diagnoses are, going to be what anyone would use to diagnose someone. The basic symptoms, kind of condensed, so that you can say, oh, if I see that, you can kind of say, not that I have this or self-diagnose, but to just say, maybe I should go see someone to verify if that's true. So that would be recognized. Then next we have recovery. So in recovery, we talk about three different things. I'm pretty sure there's like more than three ways to recover from these illnesses and diseases that I will discuss and disorders that I'll discuss, but we will break it down by treatment options, which would be medications and or supplements, wellness options, and lifestyle options. So we'll try to go through as many as we can. And this is also a place where I would like, participation because I may have like certain things that I think are helpful or that have been evidence based. That's why I would share it because I feel like it's evidence based or I've seen it work. But you all might say, hey, I found that this type of thing is helpful, or I found that that type of thing is helpful. So sharing is caring. I want us to kind of share with each other. I also want this, I don't have it anywhere specifically in here, but I do want to emphasize that I want this to be a respectful environment. So, like, you know, you can say what you want in chat, but, I might not respond. So, to be honest with you, I might not respond to anyone because I don't even know if I'm using it right. I haven't seen anything. So I don't know if I'm not seeing anything on the chat because there is nothing on the chat or I just can't see it. But either way, um, sharing is caring. And then, I might even be able to go back. I think on certain platforms you can go back when there's comments. So on replays, I can go back. So if you do have comments and say, hey, I thought this was interesting, I could probably still come back and talk about it. So I do want this to be like interactive and even to that extent, not just during the lives, but also on when we repost it. And last but not least, we're gonna do resources. This yeah. So we're gonna do resources. I'm gonna go back over this because I did do this lecture a while back, but I will go back over this to make sure the resources that I do have are diagnosis specific, but also helpful for each of the different things that we go through. So um, I will, I will go through and make sure that they're accurate because you never know. Like sometimes a website could be down, what have you, but I will go and make sure that they're accurate for the most part. But even still, I'll try to even this would be a good time for group participation. Say like, hey, I found this app helpful because I don't have any. I don't believe I have any apps up here. So this would be a good time for people like, hey, I found this this app helpful, or hey, I've been using this website and it's been helpful to me. That type of thing. Because sometimes things change, but I'll try to make sure that they're updated as of when I present it. But this would be another good place that if you know any resources, please share them. So that's basically the intro of the course. But we are not going to stop there. So let me bring the screen just to me so you can only see me. We're going to just do it where you can only see me. Where am I at? Hello. And then I am going to make sure that um, I don't think we're going to do depression today. We'll just do a common question that I think a lot of people have when it comes to mental illness disorders, depending on, what jargon you're on. A lot of people wonder, and this is why I have it here. And to also show you how the rest of the series will go, why them? Like, why we're going to talk about all these illnesses, disorders, what have you. Why me? So let's do that next. And then next time I come on a live, I want to say that I'll come on at a regular time, but I also know myself. So the goal will be that I'll come on at least once a week. And when I come on, I'll do the live. I'll do like, maybe one or two of them or however I'm feeling. Likely no more than two. And then I may do that once or twice a week. And afterwards, I'll have, for this whole one, I'll keep them up. I'll keep all of them up. So I'll have all of these up because this is something that I really feel like is like invaluable information, basics for most people to know. I'll have all of these up and I'll keep them up on, I think right now it'll be on Facebook too. So Facebook and YouTube. And then later on, when I do other series, I might have the first lecture of that series posted and available, and maybe like some like highlights. But I'll start a Patreon where you would have to subscribe to the Patreon to see those highlights, and then also I'll throw in a T-shirt too because I sell merch. So that's the plan. But for right now, sit back and relax because all things mental health will be free and readily accessible, and I'm not going to take it down for the foreseeable future. So, all right. So why me? So we're gonna do the next lecture, and this is a good one to do because you can kind of see the format of how I do it. So um, when someone comes to an office, we have something called a chief complaint. It's not to mean that you're like complaining. It's basically saying like, what is the person coming in for? So that's what you'll see in quotations. So we'll have like what the person is coming in for, and then what the discussion will be about. So this is a very short one where we'll talk about why me. The person's coming in like, I don't understand why I have to have any of these. Like, what is going on? And this is a discussion about how a mental health illness, disease, disorder starts. All right, so how does it start? Excuse if you can hear anyone in the background. There's a lot going on here. So nature. So there are what we would call non-modifiable, which things you cannot change, and modifiable, things you can change, risk factors. And essentially we call those nature versus nurture. Non-modifiable being nature. Now, as of I don't even know if I can even say that. Due to technology, people are already trying to fix genes and what have you. And then even from the onset, I think is some technology. I don't know how much it's based in terms of like how to prevent disease. You can probably change genes before a child is born, but for the most part, we're going to say that nature is some of the non-modifiable factors, risk factors. So these are things we were born with and natural life causes. So things to be mindful of, um, things to be mindful of, and just cognizant of just like certain illnesses, diseases, disorders, whether it's mental or physical, any of them will kind of still have this breakdown of nature versus nurture, ironically. So there's sex, um, and this is chromosomally wise, what your sex is. This is age. Um, Actually, gender. even if we get outside of like chromosome, sex, and gender identity, those are still risk factors. Um, Age, so you can't really modify that. Genetics. So when I say genetics, I'm really, it's to some extent, you know, initially it was always like the genes you have are the genes you're going to work with. I don't know if that's always going to be the truth, but something that is genetically based are is your family history. So, for instance, many illnesses run in families, and I'll talk to someone about, they'll hear that or they'll see that and they'll say, well, that has nothing to do with me. If such and such had XYZ, and unfortunately, that's not always true. Like, it can have nothing to do with you, as in you're your own person and your own life and you have your own journey, but genetically, you may share the same genes as your loved one who is going through something. That doesn't mean you're going to be the same as that person or have the same course as that person, but it is something to be mindful of. When you see symptoms or things don't quite add up, it is something to be mindful of. This is so much true that sometimes, for instance, like I order something called GeneSight, which it can tell you based on genetics what medications might have not might not work, might have side effects, or might just be too high, a load of serum in your blood, what have you. Um, that test can test for that. But a dirty way to test for that is sometimes, let's say your mom was taking something and you have the same illness. If you take it, it might have similar efficacy, or it might work the same. See the jargon, efficacy? Told you. I can't help myself. So sometimes not only do you have the predisposition to maybe the same disorders, illnesses, diseases, you might also have the same effects. You might experience the same effects on medication, therapies, and drugs as well. Another thing with nature is hormones, big ones for women, puberty, uh, PMS, before your period, like the week before, puberty when you're starting your period, the postpartum period or peripartum, which is peri is like around when you're pregnant. So it could be the months of pregnancy, during pregnancy, um, and then also after pregnancy. So that's a hormonal time, and that could predispose someone to some psychiatric uh, situations. And then menopause. So whenever your hormones are too high or too low, it could be an issue. And hormonally in men, low testosterone, once you get a certain age, that can lead to some issues as well. Since we just mentioned hormones, I'm also going to mention with nurture, and that's the next thing. Nurture is mm, like things that happen to you during life or modifiable type of what we would say modifiable risk factors. Um, we'll do hormones isn't in my notes, but I will say with hormones, uh, when you take medications that can affect your hormones, that can do it. Or if you take any type of medication, that can also, like medications that you don't even think are going to affect your mental health can. Like you like that's for blood pressure. Why would that make me depressed? It can. So it's just something to think about. But main ones when we say nature versus nurture, main ones that we think about aside from like taking something, whether it be hormonally or just any type of medication or even the psychiatric medications themselves. Other things that we think about with nurture are trauma. So little T and big T, that's what I call it, little T and big T traumas. I don't know if that's like a universal thing, but I'll give the big T one so you know what I'm talking about. Big T traumas will be like rape, war, like clear cut abuse, assault, that type of thing. And then little t traumas are, I haven't heard this word in years, but I wouldn't also call myself like in the mix. So, but microaggressions would be kind of what we call little t traumas. They're not small things, right? I'm calling them little t traumas because they kind of add up to be a big trauma. So even though they're kind of little, they're not little. They add up into like, enough of those in themselves can cause someone PTSD or post traumatic stress disorder or any psychiatric illness. Once you have enough of these little t or even big T traumas, even aside from PTSD, you can have other illnesses, disorders, diseases. Stress. Stress is a big one for nurture. Illness and injury. So, some big ones that can cause mental health conditions, TBI or traumatic brain injury. There's so many movies, well, not so many movies, but there was movies about it with football. It happens a lot in the military. Other illnesses that aren't like that clear cut, but have psychiatric components to them can be dementia, HIV/AIDS, heart surgery or issues, chronic pain, chronic illnesses, even UTIs or infections in elderly look like psychiatric conditions, stroke, seizures right after you have the seizure. So there's so many things that look like psychiatric conditions. So there's no, even though we started off saying like, why me? I'm telling you the risk factors. I can't say why it happens to a particular person, but there's so many reasons why. Um, Usually it boils down to nature versus nurture. So let's say, why do we even do that? Because some people can have a genetic predisposition. They can have the nature part. But if the nurture part is on lock, like they're taking care of themselves, they try to limit their stress, they know their triggers, they have a good sense of community, that type of thing. They may not have the illness at all, and or the illness may be very minimally, or the illness may affect their lives very little, um, versus someone who is maybe in these kind of tumultuous situations, versus because of nurture situations, trauma, what have you. Maybe they're able to withstand it because of some type of genetic strength, what have you. We don't know, but essentially, it is a play what between things we can modify and can't modify, and just balancing it for wellness. So that's really the point of this. Like, why me isn't really what I want you to get from this series. It's like, okay, this is me. What can I do to help myself? What can I do to get help, to be helped? I'm not saying that you should be helping yourself, like, oh, just drag yourself out or whatever. But what can I do to make my life better? I don't have to. You don't have to stay um, in a place of non-functioning or decreased functioning. All right, so let me go back. That's my spiel for today. I'm going to go take it off of the lecture. So thank you for listening. And then I'm going to see if I have any comments or anything. Um, all right. Hey, Nathan, I see you watching. Thank you for watching. So I think over time, I would expect to have, more comments, more involvement. And that's what I kind of want from this to be like a give and take type thing. Also, even if you watch the replays, please comment on those. Comment on those. Let me know what you think, feedback, what have you, any thoughts, and then we'll go from there. So, thank you for listening today. I appreciate having your ear and your time, and I look forward to us meeting again next time.